Hi, I'm Dr. James Machino. How to preserve brain memory with respect to the role of diet, lifestyle, and supplementation. We've learned a lot in recent years about brain aging and how it works. And we know that certain events lead to memory loss as well as dementia and Alzheimer's disease. Now, some of these events are related to the aging process, and we'll talk about that. And some of the events are actually related to faulty dietary and lifestyle practices that actually induce damage to the brain. So let's look at how these brain events occur and the things that actually lead to memory loss and dementia through these mechanisms. The things that happen in the brain is that there's free radical damage. Because the brain uses 20% of the oxygen that's in the body at any given time, because the brain's very active, so it's generating a lot of energy for itself. It needs oxygen to do that. But the dark side of oxygen is that it generates a lot of free radicals. So you get what's called oxidative free radical damage that has a corrosive effect on brain cells and damages them over our lifetime. And brain cells don't reproduce or replace themselves like other cells in the body. The brain cells that you have when you're born, that's pretty much all those are the brain cells you're going to have for life. So you have to really protect those brain cells. If they become damaged by free radicals, they start to break down. They don't function as well. So free radical damage has been linked to not only Alzheimer's disease, but also Parkinson's disease and multiple sclerosis and some other neurodegenerative diseases, as they're called. The other thing that happens in the brain as we get older is that the brain stops making optimal amounts of the memory chemical known as acetylcholine. So as the acetylcholine levels drop down, and it happens in all of us, especially after the age of 55, the brain just can't make it as much. Memories, we start to have seniors' memories. Your memory's not nearly as good. It's a hallmark feature of Alzheimer's disease. In fact, in Alzheimer's disease, what they do is they try to give you drugs. They give you drugs that try to slow down the breakdown of acetylcholine because there are no drugs that can increase the synthesis of acetylcholine the way you did when you were younger. But I will tell you, as we're going to see in a minute, there are certain supplements and foods even that can raise the acetylcholine level synthesis in the brain even when you're older. And this is what's missing from the story. But other aspects of the brain that change as we get older is that certain dietary factors can produce brain inflammation, and brain inflammation is linked to increased risk of Alzheimer's disease. The same is true if you clog up the arteries in the brain. Your dietary and lifestyle behaviors are not great. You clog up those arteries with plaque and cholesterol. And then the nutrients can't flow, and certain brain cells become robbed of oxygen and other nutrients that they need in order to function. And so, you get brain function decline as a result of that. So these are the issues that they all accumulate and lead to brain problems. More recently, we've seen that there's a condition called type 3 diabetes. And you're saying, I've never heard of it. I've heard of type 1 and type 2. What's type 3 diabetes? Go and look it up. You'll see that I'm right. That type 3 diabetes is a type of elevation of blood sugar. It's related to diabetes, being overweight. That when those things are happening, those high sugar levels and the high insulin levels that result in those conditions are actually damaging the brain, producing glycosylation, as it's called, sugar-coating proteins in the brain and damaging them in other ways that links to a higher risk for Alzheimer's disease. So people that have diabetes, high blood sugar levels, they're overweight, they're out of shape, as they get older, their risk of Alzheimer's disease is much higher. So that's all the bad news. The good news is that the right diet, supplementation, and lifestyle plan is linked to preventing these problems. But you have to know what you're doing. The truth is that supplements alone have been shown to raise the brain levels of acetylcholine, which is the memory chemical, and has been useful in people that have some memory loss. Supplements can also improve the blood flow through the brain. That's been shown. Certain supplements can reduce the inflammation within the brain to mitigate that problem. And certain supplements also improve nerve transmission, electrical current through the brain. And the brain's an electrical organ, really, transmitting electrical currents from one nerve cell to the next. Supplements also improve the fluidity of the brain cells so they don't harden and become rigid and stop functioning. And only supplements, there are no drugs that can do this, only certain supplements have been shown to stop the shrinkage of the brain, the atrophy of the brain that occurs after the age of 60. The brain normally after the age of 60 shrinks by 1 to 2% every year, according to the Oxford Memory Project study. 1 to 2% of your brain shrinks every year after the age of 60. The only thing that's ever been shown to slow that down are certain supplements. There are no drugs. And other lifestyle practices are also really important, both physical and mental activities, to maintain the neural circuits so your brain keeps functioning. Drugs alone are not the answer. Even people that have Alzheimer's disease, the drugs alone don't stabilize the condition. The responsibility for the prevention of this problem really falls in your lap. So you have to understand the proactive lifestyle strategies. Remember that only 1 to 2% of all Alzheimer's disease is actually genetically based. The rest of it is primarily due to the aging of the brain and lifestyle-induced damage that we do to our own brains. And as I've been trying to illustrate, those changes on both aging and diet and lifestyle-induced can be prevented or certainly slowed down significantly. Alzheimer's is the 6th leading cause of death in our society. After age 60, 10 to 20% of people already have mild cognitive impairment. They're on their way to more serious dementias and Alzheimer's disease. It's only supplements, diet, and lifestyle that can actually alter the course of this. So you need a comprehensive program. My problem is that most medical doctors have not studied enough nutrition and natural medicine to really be proactive with their patients on this. And they don't often emphasize even the lifestyle, physical and mental activities that have been shown to keep the brain nerve circuits functioning at an optimal level. So what I've done is I've put it all together into an ebook that's available right here. It's called The Nutritional Guide to the Prevention of Memory Loss and Alzheimer's Disease. You need to download it right now. The Nutritional Guide to the Prevention of Memory Loss and Alzheimer's Disease. In that little e-booklet, I have all the scientific references so you know that the information I'm sharing with you is exactly right. You'll know exactly what to do to protect your brain, vitally important for your quality of life and your longevity. Now at machinohealth.com, you'll see my other research review papers. You'll see other videos I've created, footage from my live professional seminars. You'll see resources and downloads that I've created for free that you can get access to help you lead a long, healthy, functional life. All the research papers and teaching materials that I have all the scientific references in them, so you'll know you're always getting scientifically sound information from me on any health topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.